guys, this is Jason Williams, DO. This is the Williams Family Medicine channel helping you to live your best life. Today I wanted to speak about heart rate variability. Heart rate variability refers to how your heart rate fluctuates in response to stress or in response to a perceived stress. One might think that heart rate variability is a bad thing if you worry about arrhythmias, for example. Arrhythmias can contribute to sudden death. In this case, we're speaking about your heart rate varying from beat to beat sometimes based on your health status. What I'm referring to is basically a measure of function of your autonomic nervous system. In order to discuss this further, we should talk about the balance between the parasympathetic and sympathetic aspects of your nervous system. It is generally accepted that the sympathetic nervous system controls fight or flight responses, and this is when you get the rush of adrenaline all of a sudden to respond in an urgent situation. The parasympathetic nervous system is something that's mostly associated with rest, relax, and digest. Heart rate variability can be a marker for how your autonomic nervous system is balanced. People that have very little heart rate variability are felt to have poor balance between the parasympathetic and sympathetic nervous system. People that are felt to have a ramped up sympathetic nervous system are at risk for diabetes, obesity, and mental health disorders, to name a few. Heart rate variability seems to be a marker that can tip you off to the status of your autonomic nervous system. In discussing the parasympathetic side of the nervous system, the vagus nerve is critical in modulating immune system function. When the vagus nerve senses that inflammation is present, you have activation of your spleen, your liver, and even your intestine, where your immune cell function resides. What you would like is a response that is appropriate but not overly aggressive in order to respond to possible threats to your body, inflammatory threats or infection threats. No discussion of inflammation is complete without at least a little bit of a touch on C-reactive protein. C-reactive protein is something that is produced by your liver and responds to inflammation. Higher C-reactive protein levels have been measured in hypertension, cardiovascular disease, and diabetes. Other inflammatory health problems can elevate C-reactive protein as well. Heart rate variability has been used to predict C-reactive protein levels. Many other hormones have been shown to affect and improve heart rate variability. Some of these include dopamine, serotonin, oxytocin, and endorphins. In some of my other videos, I've talked about ways to increase release of these substances in your body for improved sense of well-being, etc. These are usually actually fun things such as singing, humming, petting a dog, giving a hug. As a side note, oxytocin is stimulated by vitamin D. So if you have vitamin D deficiency, you may have a problem with oxytocin levels as well. So what would be a good heart rate variability, you might ask? Heart rate variability does differ quite a bit depending on your athletic abilities and your age. I looked at a table that showed a comparison of heart rate variability across multiple ages. What I could extract from that was that your heart rate variability at age 20 may be as much as 40 points. However, at age 65, it could easily be 20 points or less. Those levels would be considered fairly normal. The next obvious follow-up is, how can you change your heart rate variability? We've already spoken about some of the ways with some of the hormones that can affect heart rate variability, but specifically, there are certain things you can avoid and certain behaviors that you can try to do regularly that might greatly improve your heart rate variability. One such thing is alcohol. Alcohol has a profound effect on heart rate variability, and even moderate drinking can affect heart rate variability by as much as 5 days, according to monitoring devices that people wear. Sleep on a regular basis at regular times has been shown to greatly enhance heart rate variability. Diet and nutrition have been found to greatly affect heart rate variability. Mediterranean type diet seems to be very beneficial for increasing your heart rate variability. Exercise is a big one. Usually people feel that exercise is good. However, in this case, if you over-exercise and do not allow yourself proper recovery, you may impair your heart rate variability for some time. So appropriate exercise with proper recovery can be very beneficial for restoring proper heart rate variability. But if you overdo it and don't recover, you may actually hurt your heart rate variability. In some of my other videos, I've talked about specific mechanisms to stimulate certain aspects, certain neurotransmitters or hormones. Cold thermogenesis is one of those, which just involves exposing yourself to cold water in a shower to increase some of these neurotransmitter releases in your body. You can also accomplish this by being outside in the cold for a time. Natural light exposure increases your melatonin levels. Melatonin levels have been intimately linked to oxytocin levels as well as to improved heart rate variability. This involves exposing yourself to sunlight early in the morning and then also sometimes later in the day before bed. This also involves avoiding inappropriate timing of light exposure, such as bright lights late at night or a lot of overhead lighting late at night. Intentional deep breathing exercises performed multiple times in the day can be very beneficial to improve your heart rate variability. Meditation practices also can significantly improve heart rate variability. Most people would like to know how to monitor their heart rate variability so they know where they are. Well, as far as devices go, you can go crazy with this. I have researched some of the devices that are out there. There's what is called a Whoop band, W-H-O-O-P, an Oura Ring, O-U-R-A, Apple Watch, Fitbit, and Polar heart rate monitors all seem to work. Some of these devices are expensive and some require subscription sign up in order to be able to download data. It's important for some people to have this type of feedback, and I encourage you to look into these devices if that's what you desire. The implementation for improving heart rate variability is not difficult and can be done with or without a device. Heart rate variability is an interesting concept, and you'll see a lot of articles on the internet about this if you do a search. In general, the take-home point is your autonomic nervous system is very important. The balance of the parasympathetic and sympathetic nervous system are what we're talking about here. Some people may not realize this, but the autonomic nervous system is very important in immune system regulation. So balancing the autonomic nervous system should be of high priority. Hopefully this can help you decrease risk of acute infections, but also risk of certain chronic diseases and inflammatory processes. If you're my patient, I hope this information is helpful for you to expand your knowledge about heart rate variability. If you are not my patient, please see your own doctor to discuss your own diagnosis and medical care. This is Jason Williams, DO. This is the Williams Family Medicine Channel, signing off.